So, and then this issue arises again and again within the literature. And this is why there's a challenge really in synthesizing this data, because there's conceptual ambiguity around forest therapy. So forest therapy is used in many, many different published research papers. But some researchers use the term to denote green exercise or talk therapy outdoors. So that's a kind of an issue that exists. So that's why it's important to operationalize. It's described currently as an emerging evidence base. However, the majority of studies have been conducted in Japan and Korea. And they've also been kind of focused on a limited demographic. So there's been a lot of male studies using males and studies using college students. So one of the, I suppose, the theories underpinning this relationship focuses on stress restoration, both psychological and physiological, which I suppose leads to a strengthened immune system. So this is one of the findings recently published by Forest Europe. So there's a strong evidence that forest visits have a positive impact on restoration and psychological well-being, improve mood and attention, and enhance psychological stress recovery. There's substantial evidence of the potential benefits of contact with nature for avoiding health problems. So that's research published very recently in 2019. So other relevant studies focus on, there's a recent systematic review focusing on health and well-being benefits of just simply spending time in forests. So not receiving a specifically targeted intervention, but just of being physically as an individual in a forest setting. So they looked at 6 randomized controlled trials. What they concluded was that forest therapy may play an important role in health promotion and disease prevention. However, the lack of high quality studies limits the strength of results, rendering the evidence insufficient to establish clinical practice guidelines for its use, and more robust randomized controlled trials are warranted. There's one, I suppose, extremely interesting RCT that was published in the United States of America in 2015. And what they did was they ran a randomized controlled trial. So just to explain to people who may not be kind of used to that term, an RCT is usually something that's used to develop or test either a drug or an intervention. And what this group of researchers did was they asked people to walk on a regular basis at a specific time in either a setting that was in a forest environment or a setting that was in I suppose, an urban environment where there may be roads and cars and other distractions. And what they concluded after they ran a randomized controlled trial, so they randomly assigned people to both of those groups, which controls for all the other variables that may influence. So the idea is that there's a group of people, they all have the same characteristics, and then they're assigned equally across both groups. And what they concluded was that rumination is a major factor in the development of anxiety and depression, and that the study itself, what they found was that people who spend more time in forest environments, that the rumination dropped quite significantly. There's also another randomized controlled trial of 48 males. This looked at assessing if the effect of forest therapy, and they found that it reduced negative mood states, anxiety, and heart rate, but it also facilitated the parasympathetic nervous system activity by suppressing the sympathetic nervous system. So the idea behind that is that the parasympathetic nervous system is your rest and digest. That's, you know, what we kind of do when we're calm. And then the sympathetic nervous system is fight or flight. So that's what happens when you're stressed. Park et al. Also conducted 24 field experiments in Japanese forests, and they found that forest walk participants had lower pulse rates, lower concentration of cortisol, lower blood pressure, and lower sympathetic nerve activity. So the next research study I'm just going to refer to is a really interesting, what's called a state-of-the-art review. So that's a particular type of systematic reviewing of the current literature that looks at saying what is the current state of the evidence, what is the current state of the quality of the interventions that are linked to this term. And there they looked at 64 studies assessing Shindin-yoku, which is the Japanese term for forest bathing, so studies that use either of those terms. And what they concluded was that there's longitudinal research conducted worldwide is needed. So longitudinal research is research that's conducted over a period of time. So it's one period and there's a follow-up and possibly another follow-up and more follow-ups after that. So the idea is that we know that nature contact, for example, has an impact in the immediate, but does it have an impact in the longer time frame? So there's a need for new evidence of the relationships associated with Shinrin-yoku and clinical therapeutic effects. So nature therapy has a health promotion method, and potential universal health model is implicated for the reduction of modern day state stress or techno-stress. So techno-stress would be, I suppose, constant exposure to technology. And stress state just relates to your actual experience of a stressful state.